Hello again. The last video I talked about syncope, which is one of the most common topic that we may experience in our lifetime. Almost 1/3 of people, they experience at least one syncope during their lifetime. And we mentioned that one of the common reason of syncope, which is loss of consciousness briefly, is vasovagal and reflex syncope. We talked about vasovagal, the mechanism of vasovagal and the manifestation of vasovagal, which basically would be feeling starting of weakness, sweating, becoming pale and tunneling vision, blurry vision, and losing the consciousness. Sometimes we get nausea or vomiting either before or after the event. We lose the consciousness and we may have risk of fall and injury in some cases if we hit our head somewhere, or God forbid in the elderly breaking the hip or like that. Usually after seconds, 20-30 seconds or a minute or two, we regain our consciousness, but we still feel very drained, we feel very weak. That weakness or fatigue may continue for an hour or even up to 24 hours. Sometimes patients, they say, all day I was beat up, and the family, they took me to the ER, they checked everything came okay, and they sent me home. In some conditions, if they are really worried, they may keep you overnight in the hospital, which carries a lots of expense, a lots of tests, and basically it's just brief vasovagal. The good thing about vasovagal is that it has a kind of usually a typical presentation, as I told you. Warm weather, or you're sitting in the car which is warm inside in a hot day. It can be even normal day. You usually didn't have much enough fluid and food that day, but it can happen even if you had your regular meals. When you wake up, usually you can do everything except being fatigued. Usually it doesn't have other symptoms like chest pain or palpitation or jerky movement in the hands or legs. It's not usually associated with losing of the urine or incontinence of the urine or PM. Majority of time it can recur again in your life. Sometimes it can happen back to back in the same week. It has waxing and waning. Sometimes it comes a kind of bout of them together in very period of weeks or months, and then it may disappear for a while, and you don't have any till years late. The downside of vasovagal syncope is number one, risk of injury. And number two is unnecessary ED or ED visit or hospitalization. Especially when our age goes up, it becomes more often. Keep in mind for elderly, especially because your autonomic nervous system, which I explained in the previous video, has been working for a long time, is not as quick and as healthy as before. So it takes time for sympathetic and parasympathetic balance to act appropriately, especially after being in the chair or in the bed for a long time. Usually may happen in the middle of the night or in the morning after you have been in the bed, you want to go to the bathroom, you come out of the bed, you feel lightheaded, woozy, and you pass out. And that's the time that majority of elderly, unfortunately, they get injury, and that turns out to a long hospitalization and many consequences. The usual recommendation to decrease the chance of vasovagal would be, first of all, have good amount of fluid and salt intake. Keep in mind, especially for elderly, if you have high blood pressure, if you have heart failure or weak heart, you're not going to have lots of fluid and salt. I'm talking about other people that they don't have those underlying disease. If there is underlying disease, of course, you have to consult with your cardiologist or your internist, and they can give you appropriate advice that how much fluid or salt is appropriate for you. And the other option which can help on those group of patient is compression socks, helps a lot. A spank, which is a kind of underwear which can go up from knee to basically belly, it's really helpful. abdominal binder can help. There are certain medication that in certain patients we may consider them either temporarily or for a longer time, including some medications to keep the blood pressure up. Of course, we have many limitations about those medications, but there are circumstances we use them. The good thing about vasovagal is not something very progressive. It doesn't mean that your life longevity is going to be shorter unless there will be consequences of injury happening. It can happen in young patients. I have had patients that they are 15 or 20-year-old. Of course, 20, 30, 40, any age it can happen. But very healthy young patient, they may get vasovagal syncope, and it can happen frequently that really affects their quality of life. So this is the most common type of syncope. We talked about that in 2 videos. I'm gonna talk about other reason of syncope on next video. I hope this would help you since it's a common condition and most of the times is preventable. Before I end this video, one of their action which can decrease the chance of syncope, especially in elderly, is that while you're sitting, if you cross your legs or if you cross your arms as much as possible, or if you're driving, if you basically firmly keep the steering wheel, they have shown that can keep the blood pressure up and decreases the chance of vasovagal syncope. One other action that you can do very simple and it can be very helpful is that, especially for elderly, that in the morning when you wake up, have 1 glass of regular room temperature water on the side of bed before you come out of the bed and you drink it. And basically having just 1 glass, you don't need to wait much, but just passing the water from your pharynx, it's basically activating a reflex called oropharyngeal reflex, and that by itself increases the blood pressure and decreases chance of vasovagal. That may help you to decrease the chance of vasovagal. And for elderly, the other things that you have to do when you wake up in the morning, when you want to come out of the bed, take your time. You sit on the side of the bed, wait one or 2 minutes, stand up, wait 1 or 2 minutes, make sure you're not lightheaded, dizzy, and then walk. Don't come out and walk right away, especially middle of the night. If you have to go to the bathroom and it's dark, try to take your time and do that. I hope all of this helps you. Stay safe, be happy, and I'll see you soon. Bye.